Hi, my name is Liz Thompson, and I'm the project manager with the Canadian Association for Long-Term Care. We were funded via the Public Health Agency of Canada and identified as a group that needed additional support post-COVID-19 due to the population that works in long-term care. Long-term care staff were hit disproportionately hard during the COVID-19 pandemic for a variety of reasons, but the main one being the staffing crisis and underfunding that has existed in years prior to COVID-19. Through our project, we are bringing a mental health education program into long-term care homes to support staff and help them become more resilient and support their mental health to the best of their ability while we still deal with these challenging times with staffing shortages and underfunding. So a lot of the structural changes during the pandemic resulted in a significant staffing shortage. One of the biggest detriments during the pandemic in terms of staffing was creating a single site advisory where staff were only allowed to work at one long-term care home, whereas many staff are employed at multiple homes. So you essentially took a staff that would maybe work at 2 or 3 homes and put them at one, and now you lose those 2 other shifts that would have been filled by that same person. And that was just one part, and not all provinces did that, but it did exist in a lot of homes across the country, which made it extremely challenging to care for the residents. You can only care for the residents so much when you have people, and when you don't have enough people, it makes it that much more challenging. Before COVID-19, this was also a problem. We've seen the staffing shortage impact long-term care for almost 20 years, and now it's really been exacerbated by COVID-19, and we unfortunately don't see it getting better unless real change is made and we're able to find and recruit enough staff to care for our aging population. But until that happens, it's looking a bit dire. I'm really excited to share that the impact of this program is going to go beyond the first year of funding. The way our program was designed was so that there would be a ripple effect and that we would have this subset of trainers. And from there, then those trainers go and train their staff. And more staff continue to be educated and learn about how to become more mentally resilient and mentally healthy in a world where we're still recovering from the pandemic. I'm so refreshed to see that the government is focusing and investing in long-term care, especially in the mental health of long-term care staff, as they have faced the brunt of COVID-19 in their homes and all of the crises that have gone along with the issues living in long-term care and COVID-19 in long-term care homes is actually being addressed. And I'm cautiously optimistic that the impact that this grant is going to have on long-term care staff is going to ripple for the next little while. Our grant is working with Dr. Keith Dobson to evaluate the effectiveness of the Working Mind program on the trainers that attend our courses. Through his data collection, we will determine the impact of the course and the content, but also look to see if there is symptoms of post-traumatic stress issues among long-term care staff that attend our program. Through this small subset of data that Dr. Dobson is collecting, the participants will then go into a larger pool of other participants who have attended other Working Mind programs and will be categorized into a larger subset that supports the overall research of Dr. Dobson with the effectiveness of the Working Mind program and any changes or improvements that can be made to further improve the program